Good morning, everybody. I'm Grishma Molugu. I'm a second-year internal medicine resident at Medical City Fort Worth. So the case report for today is titled as an atypical triad, a rare presentation of three abdominal vascular compression syndromes, that is the median arcuate ligament syndrome, superior mesenteric artery syndrome, and the anterior nutcracker syndrome. Coming to the introduction, the median arcuate ligament syndrome, also known as the celiac artery syndrome, occurs due to the compression of the celiac artery from the low insertion of the median arcuate ligament. And the superior mesenteric artery syndrome and the anterior nutcracker syndrome occur due to reduction in the space between the abdominal aorta and the superior mesenteric artery, with the aortomesenteric angle as low as 22 degrees, leading to the compression of the third portion of the duodenum and the left renal vein, respectively. This individual incidences of these abdominal vascular syndromes is very low, but what is more rare and unique is the coexistence of all the three abdominal vascular syndromes. And this case report is about the rare co-occurrence of all the three syndromes in the same individual. So coming to the case presentation, a 20-year-old male patient with no significant past medical history presented with the chief complaint of postprandial abdominal pain associated with nausea and vomiting for the last 6 months. He also reported about 20 pounds of unintentional weight loss, and he had an EGD done already about 3 months prior, which was unremarkable. And then during this visit, the CT angiography of the abdomen and pelvis, as we can see in the images at the bottom, on the extreme left image shows the indentation and the narrowing of the superior aspect of the celiac artery with the classic hook sign where we can see with the red pointer. And the next image in the middle shows the reduction in space between the abdominal aorta and the superior mesenteric artery, leading to the compression of the third portion of the duodenum, which is classic for the SMA syndrome. And the image on the extreme right shows also the reduction in between the abdominal aorta and the superior mesenteric artery, leading to compression of the left renal vein as marked by the red pointer, which is classic for the anterior nutcracker syndrome. Hence, this person was diagnosed with all the three abdominal vascular compression syndromes based on his clinical and imaging findings. So the patient finally underwent the laparoscopic release of the median arcuate ligament syndrome and was placed on a high-calorie diet. And at a 6-month follow-up, the patient had an abdominal Doppler, which showed increase in the aortomesenteric angle, and also the patient did not report any postprandial abdominal or nausea or vomiting or any kind of symptoms. So the conclusion or the takeaway points from my case report today is, firstly, I would like to highlight the uniqueness or the rare occurrence of this case. During my literature search for the abdominal vascular compression syndromes, I came across multiple case reports that were highlighting the rareness of the individual vascular syndromes, but I did not come across any case report which was highlighting the presence of all the three in the same person. So this case report is unique in the sense that it highlights the presence of all the three abdominal vascular compression syndromes in the same individual. And secondly, I would like to also highlight the pathophysiology. For this patient, it was hypothesized that the median arcuate ligament syndrome led to his postprandial symptoms, which led to decreased appetite and gradual weight loss for him. So this led to a decrease in the perivascular fat and ultimately leading to a reduction in the aortomesenteric space and ultimately leading to the aortomesenteric angle reduction. Hence, he developed the SMA syndrome leading to the compression of the duodenum and also the anterior nutcracker syndrome due to the compression of the left renal vein. So the patient underwent the release of median arcuate ligament, and at his 6-month follow-up, he was completely off or free of symptoms. So this highlights that whenever a person comes in with one kind of abdominal vascular compression syndrome, the clinicians should be alerted to look for the other two and treat ultimately accordingly. So those are the takeaways that I wanted to give away with this case presentation. I think that is the end of my presentation.